Good morning, everybody. Hopefully everybody can hear and see me. My name is Dr. Emily Coombs. I'm one of the naturopathic physicians here at Sierra Tucson, and today we're going to be talking about strategies for healthy sleep, improving the quality of your sleep. And so sleep is something that's so important, especially now in these times that we're in. And so we'll be talking about various aspects of sleep, what can cause issues with sleep, and naturopathic ways to treat that. Ironically, I did not get great sleep last night. I had visions of sleep webinars dancing in my head. So for now, I'm going to turn off the webcam. I just wanted to be able to introduce myself, and we'll focus on the slides. So I'll talk for about 20-25 minutes, and then there will be time for questions at the end. If you notice me talking kind of quickly, it's because I do have quite a lot of material, but I'm happy to circle back and clarify anything if there are any questions. So I bet you're wondering what a naturopathic doctor is. And so a naturopathic doctor, it's going to vary from state to state. Each state has different rules about naturopathic physicians, and not all of us are licensed in every state. But here in Arizona, we're licensed as primary care providers. And so that means that our training includes both conventional medicine as well as integrative medicine. And so our first 2 years are very similar to that of conventional medical school. We take our first set of boards. And then during the last 2 to 3 years of the program, we learn a lot of integrative therapies. And so integrative therapies include vitamins, minerals, amino acids, body work, dietary and lifestyle counseling, and mind-body medicine. And so really naturopathic doctors, we seek to find and treat the root cause of illness rather than just treating individual symptoms. So here at Sierra Tucson, we work very closely with the psychiatrists to come up with a comprehensive plan for our patients. So today, the objectives, we're going to be talking about the function of sleep, the factors that impact sleep, results of poor sleep, and improving sleep quality. So we all know how important sleep is. So the main functions of sleep are the formation and consolidation of memory. So that's where we take all of the pieces of our day and we're able to consolidate that into long-term memory. Repair and growth of various tissues, especially cardiovascular tissue and musculoskeletal tissue. It's really important that we're able to get into that deep sleep for that repair and growth to happen. So good sleep improves concentration and focus and really gives the brain a chance to relax. So we won't be going through this in depth, but this just talks about the sleep-wake cycle and the physical changes that happen over the course of 24 hours. And so the main piece that I wanted to focus on was this piece right here. In the evening, that's when melatonin secretion starts. And then in the morning, that's when melatonin secretion stops. So melatonin is key for getting good sleep. I'm sure a lot of us have heard of melatonin, and so melatonin is a hormone that's produced by the pineal gland in response to darkness. So when the sun goes down and there's darkness, that's when our body starts to produce melatonin. So photoreceptors in the retina signal the hypothalamus, which is kind of like the control center of the brain. That sends the message to the pineal gland to release melatonin. So melatonin secretion can be affected by not getting enough light during the day or enough darkness in the evening. It plays such a huge role in the sleep-wake cycle. It binds, we won't get too deep into the biochemistry of it all, but it binds to receptors that cause a cascade of hormonal changes that let the body know that it's time for sleep. There are a lot of things that can affect melatonin secretion. So here is the basic sleep cycle right here. And so there are 5 different stages of sleep. And so there's the first stage where you're falling asleep. The second stage is intermediate sleep, so it's a little bit deeper sleep. Really where we want to be is in this stage 3 and 4, this delta sleep. This is where a lot of that tissue repair and memory consolidation is happening. So it's really key that we spend enough time in this delta sleep. And then we have REM sleep. So that's where you're dreaming. Um, and so that can be important, especially when we're working with patients with a lot of trauma. Oftentimes, a lot of trauma processing can happen through dreaming. So, what are the causes of poor sleep? This, of course, is a non exhaustive list of all of the causes of poor sleep. And so, there are medical and physiological causes of poor sleep. One of the main ones that I'll be talking about is cortisol dysregulation, but also restless leg syndrome, blood sugar dysregulation. So that means if you are having low blood sugar during the night, that can send signals to your body um, that will wake you up during the night. If your blood sugar is too high, that can lead to poor sleep. Some medications can lead to poor sleep, and some medications can also prevent us from getting that deep delta sleep that I talked about. Chronic pain can cause poor sleep. So, if you're having a lot of musculoskeletal pain and you're waking up a lot during the night, chronic pain definitely can contribute to poor sleep. Melatonin suppression, gastrointestinal problems, thyroid disorder, pregnancy, nervous system disorders, and menopause or other hormonal changes can cause poor sleep. And we also have the main sleep disorders. So there's insomnia, sleeping too little, hypersomnia, sleeping too much. Narcolepsy is an inappropriate sleep cycle. Sleep apnea is a big one that I see. That's where you're having periods where you may or may not be, you might be not breathing properly during the night and therefore not getting enough oxygenation to the tissues. Nightmare or night terror disorder and sleepwalking disorder. And I've kind of divided it up. We'll talk in the next few slides about some psychological causes of poor sleep. Historically in science, we've really separated the mind and the body. So we've said these are disorders of the mind, these are disorders of the body. But now we know that the mind and the body are one. They're absolutely connected. There is no separating the mind and the body. And so there will be some overlap when I start to talk about the psychological causes of sleep, but just know that we are well aware of the mind-body connection. And so on the next slide, I will be talking about cortisol dysregulation. So this is one of the causes of poor sleep that I see most often here at Sierra Tucson and just in my private practice. And this is something that's not typically looked at in conventional medicine, and it's really an area that naturopathic doctors really shine. And so cortisol kind of gets a bad rap. It's often called the stress hormone, and so we think, oh, cortisol is bad. But really, cortisol is very helpful for us if it's being secreted in the way that it should be secreted. So here we see that cortisol should be at its highest right in the morning when you wake up. And so when cortisol is higher in the morning, or appropriately high in the morning, we should wake up feeling rested. We should have energy, motivation, drive. And then throughout the day, your cortisol should drop. And so it should be at its very lowest in the evening. You should be able to fall asleep, stay asleep with no issues. I don't often see this beautiful, nice looking cortisol curve with a lot of the patients that I work with. Things that can affect cortisol secretion are things like chronic stress. We have a lot of people coming in who have been, they work in the medical field, they're lawyers, they're students, they're parents, and they have chronic stress over a long period of time. Mood disorders can affect this. Any history of trauma or substance use can affect this. And so there are a lot of ways that this can become dysregulated. Cortisol can stay high throughout the day and people are really on edge, and it remains high in the evening, leading to poor sleep. Cortisol can be low throughout the day, so people are feeling really fatigued. The most common pattern that I see is that cortisol is normal during the day, normal to high during the day, and then there's this inappropriate cortisol spike that happens in the evening. And so people will describe feeling fatigued during the day, and then they get their second wind in the evening. And sometimes I have patients describe it as feeling wired and tired, and that's kind of a sign to me that there might be some cortisol dysregulation happening. And cortisol dysregulation is very, very treatable, and it's something that naturopathic physicians work with regularly. So I love talking. I could talk about cortisol. I could do a whole webinar about cortisol. But we'll move on to talk about the psychological factors that affect poor sleep. And again, there is some overlap here with the so-called medical and physiological factors. So the things that I see most commonly are depression, anxiety, OCD or rumination, chronic stress, which can again affect that cortisol, trauma or PTSD, and alcohol or substance misuse. So this is a picture that will just show the effects of sleep deprivation. So we all know what it feels like to be sleep deprived, especially lately these days, but I do see it affect the nervous system quite often. So we'll see a lot of irritability. People will have problems with memory loss. I'll see symptoms similar to ADHD. In very severe cases where people are going days without sleep, we start to see things like hallucinations, a disconnect with reality. I really want to emphasize this piece too. Sleep deprivation can impair the immune system. And so right now in our world, this is when we all want our immune system to be strong and solid and able to protect us. And so if you're not getting enough sleep, there's plenty of research out there that shows that your immune system is impaired. So sleep can be one of the key factors of supporting a healthy immune system. So sleep deprivation also leads to a risk of things like diabetes, heart disease, can affect the musculoskeletal system, increases your chances of obesity. And so it really does have a lot of poor effects on the body. So when we're talking about improving sleep, there are two major things that naturopathic doctors look at first. And so first, we want to treat the cause. We would like to address underlying health problems and mood disorders that contribute to poor sleep. So for example, if I have a patient who comes in and they're having a really hard time sleeping, they want me to give them a supplement to help with sleep, and then I find out that they have sleep apnea that's untreated. If they have sleep apnea that's untreated, there really isn't a supplement protocol that I can put them on that's going to help them get good sleep. We really have to treat the underlying causes. Another thing that's really important in naturopathic medicine is removing the obstacles to cure. So obstacles to cure are really defined as anything that gets in the way between you and your health goals. And so for today, our health goal is to get good sleep. And so removing obstacles to cure, main obstacles to cure are alcohol, substances, caffeine, nicotine, and then sleep disturbing factors. So a lot of us may have a partner that may snore at night and keep us awake, and we want to sleep with our partner. We don't want to remove our obstacle to cure, which may be our partner. And so we could consider things like earplugs. I do have patients who have a snoring partner and they do end up sleeping in separate rooms. So you have to figure out what's going to work for you. Other sleep disturbing factors include having pets or children in bed. I can't speak to the children piece, but I can tell you that I do have a dog. His name is Skunk. He's 3 years old, and some of his favorite nighttime hobbies include ripping the covers off of me at 3 in the morning, sneezing in my face, and shaking his ears back and forth so he sounds like a little machine gun. So we are working on training him to not sleep in the bed, because I do notice I sleep much, much better when my little skunk is not around. So the next step in improving sleep is going over sleep hygiene. So sleep hygiene is basically modifying your behaviors to set yourself up for good sleep. And so it's really important to maintain a regular sleep schedule. So you want to wake up at the same time and go to sleep at the same time every day, even on your days off. You don't want to be waking up at 6 in the morning for work 5 days a week and then sleeping till noon on your days off. You really want to maintain that regular sleep cycle. You want to avoid long naps during the day, although shorter naps like 20 to 30 minutes have been shown to improve alertness. If you find yourself having a hard time sleeping for 15 to 20 minutes at a time, I don't want you laying in bed staring at the ceiling. It's important that you get out of bed and do something else. So you can stretch or you can do a mundane activity until you feel sleepy. You could do some light reading. I don't recommend reading like a mystery novel or anything like that, anything suspenseful. Usually I tell people, get out of bed and read your refrigerator manual for 15 to 20 minutes until you start to feel sleepy enough to get back in bed. It's really important to have an environment that's set up for sleep, so you really only want to use the bedroom for sleep and sex. I don't recommend watching TV in bed. I don't recommend hanging out in bed during the day or doing anything else in bed other than sleep and sex. So that way, when you enter the bedroom, your body knows that one of two things, or possibly both, are going to be happening. And so that kind of sets your body up to get ready for sleep. We want your environment to be comfortable, dark, cool, and free of clutter. Remember how important it is to have that darkness so your melatonin secretion can be regulated. This is a big one for people. So discontinuing screen time is really, really important. So I want people to discontinue screen time. So that includes TV, phone, computer, iPads, at least 1 hour before bed. If you're laying in bed looking at your iPhone, you're sending your brain the message that, oh, hey, there's light. We don't need to secrete melatonin. And so it's really important to discontinue that screen time. I'm not saying that technology does not have a place when it comes to sleep, and we'll talk about that a little bit later, but getting rid of that screen time can encourage proper melatonin production and secretion. So during the day, there are things that you can do to improve your sleep at night. So you want to make sure that you're exercising on a regular basis, not doing a bunch of cardio right before you go to bed, but maybe exercising in the morning or in the afternoon. Getting regular exercise can improve your sleep. Yoga, mindfulness, and breathing exercises help to regulate the nervous system. And then getting appropriate sunlight exposure is really important. So I moved to Tucson from Seattle, where sunlight exposure is not always possible. And so if you live in one of those areas where there is less sun, it would be important to consider using a light box in the morning. And I am noticing now many of my patients are working, they were previously working at home before coming into Sierra Tucson. And so even if you are working at home, it's important to, get outside, get some sun first thing in the morning, and get some good sunlight throughout the day as well. So now we're going to talk about some more specific naturopathic treatments. And so I really want to be clear here that naturopathic treatment protocols, they're very individualized. And so there's no one-size-fits-all approach to treating sleep problems. And these treatments are not intended as medical advice. So I encourage you, if any of these treatments interest you, to find your own naturopathic doctor. And so naturopathic.org is a great resource. You can click on the Find an ND tab to find a naturopathic doctor near you. And so when I work with patients in private practice, they're never coming in and saying, I have sleep problems, and I'm like, oh, okay, well, here's the magic supplement that's going to help you with sleep. We talk about everything. We talk about their emotional health. We talk about their diet. We talk about their home environment. We talk about stress. We talk about everything. And so naturopathic medicine is really a whole person, whole body approach. I think everyone should work with a naturopathic doctor, but I might be a little biased in that area. So some of the main nutraceuticals, excuse me, some of the main nutraceuticals or supplements that I use with patients, they're broken up into a few different categories. And so I do a lot of amino acid therapy with patients. I do a lot of neurotransmitter support. We use hormones, and then we also use vitamins and minerals. So some of the most common amino acids that I use with people are L-theanine and glycine. I would say that I use L-theanine a lot more frequently. But the reason that I like L-theanine is because it's especially helpful for the patient that tends to have a racing mind. And so they're laying in bed at night, they can't shut their mind off. It's just going and going and going. And then during the day, they're having a really hard time focusing. So there's some really good research on using L-theanine for sleep and also for focus. And so the great thing is that this can be, all of these supplements that I talk about can be used in combination with sleep medications. They can be used with or without sleep medications. Glycine is another amino acid. I typically use that in powder form at night before you go to bed. And that's been shown to decrease sleep latency. So it means that you're going to be able to fall asleep quicker and have deeper sleep. I also like to use neurotransmitter support, and so GABA, this is something that always comes up when I talk with patients. And so GABA is a neurotransmitter. That stands for GABA aminobutyric acid. And the reason that I like GABA so much is because it really, really works with patients. And so when patients are taking things like benzodiazepine medications, and so those are, things like Xanax, Valium, those types of medications, the way that those medications work are by binding to GABA receptors in the nervous system. The problem with those medications is that they can become addictive. We can have withdrawal effects. We can have side effects with those, and then they don't really treat the underlying issue and can lead to more anxiety when people come off of those medications. And so GABA is a natural over-the-counter supplement that people can take that's going to bind to those same receptors in the nervous system. And so when GABA receptors are bound, it sends the message to the nervous system. It's an inhibitory neurotransmitter, so it sends the message to the nervous system that, it's okay to relax, it's okay to calm down. And so a lot of the herbs that we're going to be talking about on the next page are going to help increase GABA circulation and GABA binding, but you can just use GABA on its own. We do use hormone therapy, so I do use supplemental melatonin with patients. The important thing to remember is that you really want to use this short term. I found that melatonin long term starts to lose its efficacy. And then I also have concerns about melatonin, if you're taking in a bunch of supplemental melatonin, there is the question of, is your body going to continue making its own melatonin? In terms of vitamins and minerals, I use a lot of magnesium and vitamin B6. I love, love, love magnesium. It's very safe for use in children, for use in the elderly. And so I know that we're running a little bit short on time, so I am going to get to the next slide where we're going to talk about the herbs. So I did my undergraduate study. I got a bachelor's degree in botanical science from Bastyr University, so I love using herbs with patients. And the thing I love about herbs is that a lot of them are becoming much, much more researched. And so lavender, ashwagandha, California poppy, valerian root, chamomile, hops, magnolia, jujube, passion flower. These are all herbs that I use with my patients for sleep and for stress. And now there's a lot of evidence supporting the use of these herbs. And so there was a study that showed that certain oral lavender preparations are just as effective as in treating anxiety and sleep disorders as a benzodiazepine medication. Ashwagandha has been known to lower cortisol levels, and so I really like that if people are having that inappropriate cortisol spike in the evening. Other resources, and I won't go through each of these resources, but these are ways to use technology to help you sleep. And so these are just different apps that you can use, podcasts that you can use, biofeedback or neurofeedback you can do with a practitioner and then learn skills to do on your own. And then progressive muscle relaxation is something that you can learn. There's a lot of good information on YouTube about that. So I know that was a lot of information, and we're sort of running low on time, so I am going to get to some questions here. So let's see here. Okay, so how do you check for cortisol levels? This is a great question. So ideally, we do cortisol testing here at Sierra Tucson, and the best way to test for it is through saliva, and so that's called diurnal cortisol testing, or cortisol testing times 4. It's where your naturopathic doctor or your physician will collect your saliva at 4 points throughout the day, and then send it into the lab, and then they will be able to see if you're getting that nice, beautiful cortisol curve that we talked about. Okay. Another question is, how do you feel about essential oils? I love using essential oils for sleep. I think right now there's a big push for people to be ingesting essential oils. I, in general, do not support the ingestion of essential oils. I think that sometimes people feel that if an oil is natural, it must be safe. That's not always the case. Essential oils are very, very concentrated, and they should be used safely. And so I do like using essential oils like a lavender or a chamomile in a diffuser and like in the bedroom at night. So topical use of essential oils diluted in a carrier oil would be fine. Diffusing essential oils would be fine. If you're going to be ingesting essential oils, I highly, highly, highly recommend checking in first with a naturopathic doctor. Okay, and so I see another question about how can I find out if naturopathic doctors are licensed in my state? So that's a great question, and so I will direct you back to, let's see if I can find it here. If you go to naturopathic.org, you can see if naturopathic doctors are licensed in your state. And so the scope of practice is going to vary from state to state. Here in Arizona, we can prescribe medications, we can run labs, we can diagnose. There are some states where we're allowed to do less. We may only be able to prescribe certain medications and not others. We may not be able to act as a primary care provider. But if you go to naturopathic.org, you can see which states you're licensed in or were licensed in. And then also if you're in an unlicensed state, there are doctors that do telemedicine, so you can do a phone conference with a doctor in a licensed state. Okay, so we do have, wow, there are a lot of questions that we won't be able to get to, but my contact information is going to be right here. Real quick. So I just want to thank everyone for coming to the sleep webinar. I really, really appreciate having so many attendees. If you look here on the screen, my email address is here, and so if there's any questions that I didn't get to, or if you have any further questions, just shoot me an email. I'm pretty responsive to email. And again, I just want to thank everyone for coming, and I hope everyone is able to get some good sleep and has a great day today.